Hello dear patients and our followers. I am Dr. Ahmedov, hair transplant surgeon from Smart Hair Clinic, Istanbul, Turkey. Today I would like to share with you the results of our patient who underwent a hair transplantation surgery in our clinic almost 16 months ago. This is the 34-year-old white male with the Norwood type 5 to Norwood type 6 of the hair loss. We call it sometimes a mixed type of the hair loss. As I've mentioned in earlier videos and our programs, the first thing we always do when we evaluate our patient is we see what's the level or degree of the hair loss the patient has. For this purpose, we use the Norwood-Hamilton scale. And on Norwood-Hamilton scale, the hair loss in man or males is basically staged or has a level starting from Norwood type 2 up to the Norwood type 7. Norwood type 2 means the lowest type of the hair loss, and Norwood type 7 meaning the highest level of the hair loss. The higher is the degree of the hair loss the patient has, the higher is the need for the grafts we need to get, number one, and number two, high is the chance that some patients may require more than one surgery to acquire better coverage and the density. Before the patient has a mixed type of the hair loss, the front and the mid-scalp areas is closer to Norwood type 5, and the crown area, due to its size that's almost like 70 centimeters squares in size, is closer to Norwood type 6. For this type of patients, on average we may need the numbers varying between 4,500 to 6,000 grafts. Of course, number of the grafts may vary from patient to patient depending on the size of the open area, the density you want to acquire, and expectations, but that's an average numbers. And the main plan for the patient was the reconstruction of the front hairline, covering the front area and the mid-scalp. That was the top priority for the patient. And with the second surgery later on, the planning to do the crown area reconstruction was planned. So the patient has undergone a hair transplantation surgery in our clinic in September of 2024 with 4,500 grafts. The reconstruction of the front hairline, the coverage of the front area, front forelock, front third, and the mid-scalp transition areas were carried out. Out of these 4,500 grafts, 3,000 of them were implanted in the front area and 1,500 in the mid-scalp and the mid-scalp transition sites. The front area always has the highest possible density when we are doing the reconstruction of the front hairline and front area, because whenever the people see you or whenever you go outside, people mostly see you in this front area. So we pay attention that the front line and the mid-scalp have the good density. And here you can see the results of the patient 12 months after the surgery. You can see the front hairline is reconstructed, the hairline is solid, looks natural. We pay a particular attention to the fact that the hairline looks natural and actual. What does it mean? As we may get older, our hairline naturally recedes more to the back. This is called the maturation of the hairline. So the hairline we have in our 20s is not the same when we are in our 40s or 50s. Even in men with no hair loss, it happens, and the hairline should match our age. We don't want the patient to be in his 40s, 50s, 60s in the future with the hairline of the boy in his 20s. That's a very important point, and we always have to keep it at the back of our mind. So the hairline always looks, as we mentioned earlier, natural and actual. So the hairline is redone, the front area is covered, it has a good density, the mid-scalp is covered. So when you look to the patient's face from the front side, he has a really good coverage. It's a life-changing surgery. It has changed the patient's self-esteem, made him more comfortable in his life. And with the second surgery in the future, we plan to do reconstruction of his crown area. But before the surgeries, and to avoid furthermore loss of the non-transplant hair, we definitely advise the patient, and particularly in this patient's case as well, the medical treatment. It can be minoxidil, it can be finasteride, it can be a combination of both of them. I always tell the patient it's like playing with the puzzle. You have the hair loss, we fit it in. But if over the time your non-transplant hair, pre-existing hair, continue to fall out, we may end up with the new empty spots between the transplanted areas and native non-transplant hair, creating empty gaps, and the patient goes into the infinite loop of hair loss surgery and hair loss surgery. But the donor area has its limits as well. So I always tell my patients the best surgery is not having the surgery. If you can avoid it with medical treatment, that should always be option number one. So this was the story of our patient who underwent the surgery in our clinic with 4,500 grafts and Norwood type 5 to Norwood type 6 of the hair loss. The patient is happy, we are happy, and hope that with the second surgery we'll be also able to cover his crown area and he will have the best possible outcome. Thanks for watching, guys. Stay tuned. If you have any questions, you can always ask them underneath the video in the comment portion, and we'll be glad to answer them. Stay tuned and take care.